Hey everyone, welcome back to my channel. I'm Sheila G the PAC, and this video is going to be all about the most common benign skin lesions that we see on skin exams. If you find this video helpful, please like, comment, and subscribe to my channel for all things dermatology content. So let's go over the most commonly seen skin lesions that are quite often a worry to patients but are in fact perfectly healthy. First are seborrheic keratoses, which are extremely common age-related spots that have a warty or waxy appearance, and they may often appear stuck on the skin because they're so superficial. Now, these lesions start to occur around age 40 and can occur anywhere, but we tend to see them more often on the face, under the breast, and on the trunk. They're often thick, kind of crumbly, and sometimes they can become itchy and irritated on the skin. These are completely benign, but for irritated lesions, we may often treat them with liquid nitrogen, where we freeze the spot and it falls off in about 10 to 14 days. Patients often come into the office very concerned about these lesions because a lot of them can be dark in color, but they're completely benign, nothing to be concerned about. Next are cherry angiomas, which are bright red or deep purple dome-shaped bumps on the skin that start to appear usually around age 30. Now, these are small collections of blood vessels, so they easily bleed. These have more of a genetic basis to them, and it's not because you eat a lot of cherries. Now, these can easily be removed cosmetically via electrodesiccation, which means cautery, just burning them off, or you can use a laser. Then we have dermatofibromas, which are firm, dome-shaped lesions with overlying hyperpigmentation in sites of previous minor trauma. So these are more common in women and more common on the legs. The most common reason that I see these is usually because of an insect bite or shaving. These feel very firm, like a little ball underneath the skin, and the way that I describe these to patients is it's basically a collection of fibrous tissue in the dermis, similar to a scar, but not exactly the same. Then we have solar lentigos or lentigines, which are tan or brown patches on sun-exposed areas of the skin, such as the face, the back of the hands, and the arms. Now, these are more common in older patients and those with more fair skin types. They may look similar to freckles, but as opposed to a freckle, these appear later in life and they do not fade with time. Then there's sebaceous hyperplasia, which are basically an overgrowth of the oil glands known as the sebaceous glands. Now, these can be single or multiple pink to yellow little bumps on the skin that have a central dell and tracing blood vessels. Now, sometimes these can be confused with basal cell carcinoma, but when you have multiple lesions that look like this that come up around the same time, the diagnosis of basal cell carcinoma is much less likely. These tend to occur more frequently in patients with oilier skin types. Good old-fashioned skin tags, we call these acrocordons. These are basically flesh-colored, pedunculated, meaning they're on a stalk kind of lesions, and they present more commonly on the neck, under the arms, and sometimes in the groin area or any areas of friction. These often have a genetic predisposition, but may also occur in patients that have a metabolic condition such as diabetes. These can be removed cosmetically in the office, either with liquid nitrogen, or we can numb them up and just snip them right off. Then we have miliasis, which are small white bumps that form from skin cells getting trapped underneath the skin. And so they leave a little white bump that looks almost like a pearl on the skin, very commonly found on the face, especially around the eyes. Now, these can often be seen in infants as well, and then they eventually go away. But these are commonly found in adults as well. Now, these can be pretty hard to pop on your own, so we can do that easily in the clinic via extractions, and it's actually pretty fun to do. Then we have benign moles, or what's called acquired moles, which these are often found in childhood, and they may grow a little bit with age, and some of them eventually involute or just kind of disappear. I want to make a whole other video focused on different types of moles, but regardless of the type of mole, benign healthy moles tend to have a uniform pigment and are usually 6 millimeters or less in size, but not in every case. When looking at somebody's moles, we look at the signature nevi, which means the pattern that one makes. And we look for what's called the ugly duckling sign, or any mole that stands out from that pattern. Please routinely get your moles checked by your dermatologist. So there you have it, a quick and easy review on the most common benign skin lesions that we see in the clinic. For more dermatology content, please don't forget to like, comment, and subscribe to my channel. Thank you so much for watching, and I'll see you next time.